Welcome back to RAAONLINE. Myself Dr. Rahul, and today we are going to discuss the neuroanesthesia basics. Sometimes in the long case also you got a traumatic brain injury and you have to need to know the basics of neuroanesthesia in order to do the different questions of traumatic brain injury, hydrocephalus. They will generally go on asking what is ICP, what is cerebral perfusion pressure, how to measure the ICPs. These type of questions generally they go on asking, and the basics of neuroanesthesia we have to study also, and we have to know also in order to do different neuroanesthesia cases in the OT. With this background, I am going to start this neuroanesthesia chapter. So the first question is the circle of Willis, or the blood supply of the brain, the arterial supply of the brain. So here we are going to discuss about the circle of Willis. Circle of Willis, once upon a time, and in the year in the year around 2020, it is asked as a 5 mark short note in the NB exam. Okay. The arterial blood supply of the brain is composed of the pair right and left internal carotid artery, which gives rise to the anterior circulation, and the paired and right and left vertebral artery, which gives rise to the posterior circulation. So internal carotid artery gives rise to the anterior circulation, and the vertebral arteries gives rise to the posterior circulation. Here it is internal carotid artery. The branches are anterior carotid artery, middle carotid artery, and here in the vertebral artery they form the pica, ica, and everything. We will discuss everything. The connection between the two vertebral arteries arise to form the basilar artery. The two vertebral artery they combine to form the basilar artery. Here is the basilar artery. This is the vertebral artery. This is the vertebral artery. They combine to form the basilar artery. The internal carotid artery and the basilar artery connect to form a vascular loop. Here the basilar artery and the internal carotid artery they form the loop here. The called circle of Willis at the base of brain that permits collateral circulation between both the right and left anterior and posterior perfusing arteries. The two vertebral arteries they combine to form the basilar artery. From the basilar artery they originate the posterior circulation artery or the posterior cerebral artery. Here we have see the anterior coronary artery, anterior cerebral artery, and middle cerebral artery. Here there are two anterior cerebral artery that combines for anterior communicating artery. It is the branch of ICA. Here you can see this middle cerebral artery. They form a communication with the posterior communicating artery, and they also give rise to the anterior communicating artery. So finally, anterior cerebral artery, anterior communicating artery, the posterior cerebral artery, and the posterior communicating artery, and the middle cerebral artery, they form a vascular loop, so called as it is known as the circle of Willis. This anterior spinal artery also arises from the vertebral artery. When the vertebral artery is entering into the brain, they form a short branches, and by the combining of these two arteries, they form the anterior spinal artery. There is also the originator of the pica, posterior anterior cerebral artery. Also, they are from the branches of the vertebral artery. So here we can see the two vertebral artery combines to form the basilar artery. From the basilar artery, we see this is the posterior cerebral artery. In the internal carotid artery gives rise to the branch of anterior cerebral artery and middle cerebral artery. This anterior cerebral artery gives rise to two branches, and this middle cerebral artery forms a anterior communicating branch and the posterior communicating branch to form the circle of Willis. Fine. So there will be always a communication between the anterior and posterior arteries, and also there will be a combination between the vertebral artery and the internal carotid artery to form the circle of Willis, which supplies the brain. So circle of Willis is a 5 marks question. You have to do a diagram of the circle of Willis. So this is the complete loop of the circle of Willis. It is the anatomical variations observed in the patients. For the sake of completion, I am keeping this picture, and it is taken from Miller. It is also taken from Miller. Okay, Miller you can see the literature also, you can learn everything. So this is basically the diagram of the circle of Willis. Mostly the anterior circulation will be formed by the internal carotid artery, and the posterior circulation will be formed by the vertebral artery. Vertebral artery combines to form basilar artery. Basilar artery will form the posterior cerebral artery, and also the internal cerebral artery gives rise to anterior cerebral artery and middle cerebral artery. There will be two arteries combining anterior communication artery and posterior communicating artery. They will form a loop that is known as a vascular loop. This vascular loop is known as circle of Willis. This is the diagram. Coming to the dural sinuses, there are three sets of veins drain from the blood from the brain. The superficial cortical veins are within the pyometer and the brain surface. The superficial vein. Deep cortical veins drains deeper structures of the brain. These veins finally drain to the dural sinuses, of which the superior and inferior sagittal sinus and the straight sinus, transverse sinus, and sigmoid sinus are major dural sinus. So what are the sinus? Superior sinus, inferior sinus, straight sinus, transverse sinus, and sigmoid sinus. Here you can see this is the superior sagittal sinus, this is the inferior sagittal sinus, this is the straight sinus, this is the sinus confluence, and this is the sigmoid sinus, this is the transverse sinus. All they drawn to the jugular vein. From the superficial, here you can see the superficial sets of vein, superficial and deep cortical veins via the pyometer, they drain from the brain surface, and deep cortical veins drain the deeper structures of the brain, and all these superficial and deep cortical veins finally drain to the dural sinuses, And these are the major dural sinuses. Superior sagittal sinus is a dural sinus, inferior sagittal sinus, straight sinus, sigmoid sinus, transverse sinus. All the sinus finally confluence and they drain to the jugular vein. So this is the venous supply, a venous drainage, so to say. Venous drainage of the brain. This is the arterial supply of the brain. Arterial supply, circular wheel is 5 marks question. The venous drainage not come in the exam, but they will ask what are the sinus present in the brain. At least you can name 2 to 3 or 4 sinus. And how the venous drainage takes place in the brain, they will definitely go on asking. So mainly remember superior sagittal sinus, inferior sagittal sinus, straight sinus, sigmoid sinus and transverse sinus. And these are the major vein sinus. And they finally combines and joins to the jugular vein to drain the blood.